Hello, everyone. Thank you for joining us wherever you are. I'm Gulo from Jadi PNS, will be your host. Now we are with Patrick Fynn. He is founder of StandOut Care from Ghana. Hello, Patrick. How are you?
I'm doing well, Gulo, and nice to catch up with you here today.
Yes, thank you so much for joining us, and we are really excited to have you here, Patrick.
Thank you, too. You're welcome.
Mhm. Patrick, could you please give us a little bit of your background?
My name is Patrick Fynn. I am a Ghanaian, born, living, and a resident in Ghana. I practice as a primary care physician, primarily with the Ghana Health Service. My everyday roles involve seeing patients, attending to their healthcare needs. I also have a non-governmental organization called StandOut Care that operates in Ghana. Our vision essentially is to take primary health care to underserved populations as a way of complementing the delivery of primary health care. I'm also a One Young World ambassador.
Wow, that's amazing. And Patrick, you're a medical doctor, aren't you?
So in Ghana, we have medical doctors, we have physician assistants. In other jurisdictions, you call them clinical officers or physician associates, and that is what I am. But the work we do essentially is basically very similar to a medical doctor.
All right, perfect. And what inspired you to be that profession?
Right. So being a physician has been an innate passion that I think have built um, from my childhood. I am a person who loves to serve. I find the art of helping people, the skill of healing, I find it to be very exciting. And to see that I'm able to help people overcome their everyday challenges for me gives me a good night's sleep. And, medicine and medical science is formed on the foundations of science, where you get to understand how stuff work. You get to ask yourself, why does this happen? And what is this? And um, answers to everyday questions. That excitement I get from understanding how things work built my interest in science, biology, and eventually I ended up practicing medicine.
Mm-hmm. And then what does health access in Ghana look like right now?
I must say, first of all, Ghana is a developing country. We are a middle income country, and we have made significant progress in terms of making healthcare accessible to people. But we are not there yet. Our healthcare system is fraught with a lot of challenges. But when it comes to access, we've made some progress. So in Ghana, the healthcare is delivered at, let's say, 5 levels. People can access healthcare in what we call health posts or CHIPS compound. These are very basic facilities. That's the first level. And they've been made available in almost all communities in Ghana here. When you go beyond this level, when you come to health centers, and then there are district hospitals, and then there are regional hospitals where the level of specialties begin to increase at this level, and then tertiary hospitals. When it comes to the fundamental basic levels, the CHIPS compound, the health centers, as much as possible in Ghana, they have been made accessible in many places. So, for instance, you would find communities where a health post or a health center is delivering healthcare to about 20,000 people. So, in essence, the access is there. However, the problem is that within the access, there also exist access challenges. So, for instance, you could easily find a health center, but when you find the health center, you may not be able to access the healthcare as quality as you would want it. So you're likely to go to a health center. It exists in the community, but they may not have a physician, or they may not have a midwife, or they may not have adequate healthcare capacity. Or you go to a health center where drugs, medical essentials and logistics needed to work are not available or are not adequate. So although the structures are there, but its capacity is quite of a problem. And this is where we keep encouraging government to revamp the system. One of the problems that we've been able to solve in Ghana when it comes to access is the cost of healthcare. Somewhere in 2003 and before that year, healthcare in Ghana was a cash and carry basis. You walk into a hospital, you take money out of your pockets to pay. And this became challenging for the poor Ghanaian or the low income person. Until 2003, when the government introduced the National Health Insurance Scheme. And with the National Health Insurance Scheme, you pay a small amount of money, about $5 a whole year, and that is enough for you to access healthcare. So with the coming in of the National Health Insurance, the delivery of healthcare has been made accessible to everybody, irrespective of your financial capacity. And it has eventually made delivery of healthcare quite improved as compared to decades ago.
Looking at the circumstances of the health access in Ghana, then you found it StandOut Care. How was the story, Patrick?
StandOut Care essentially was to complement the access gaps. Like I mentioned, about 85% of Ghanaians have access to healthcare. That's a fact. But within the access, there are transportation challenges, there are cost challenges, there are socio-cultural challenges, and some of these gaps have to be filled. And that is where NGOs like StandOut Care come in. We came in to take the healthcare to those communities that still do not have access. Let me emphasize that although access has improved, it is better in urban places. People in the cities and the developed parts of the countries do not have problems with access. But people in the rural areas, the hard to reach communities where there are no roads, there are no electricities, where the people are poor, they are still struggling. And there are also populations that are marginalized. For instance, prisoners. For instance, people with disabilities, orphanages, and populations that by their demographics will not be able to access healthcare. These people must not be left out. And that is what StandOut Care seeks to do. We identify the people who cannot benefit from the existing health accessibility scheme, and we take the hospital to these people. Okay, so there are villages in Ghana or there are rural areas in Ghana where people have to walk several miles to get to a hospital. And when they get to the hospital, they may not even find a physician. Those are the people we are concerned about. We mobilize ourselves, health professionals, logistics, and take healthcare to these people. So the vision of StandOut Care came as a way of complementing health access in Ghana.
So other than those people that you have benefited, are there any specifically the beneficiaries of StandOut Care?
Our beneficiaries are, one, underserved communities. If there is any community in Ghana where their accessibility of healthcare is not optimum, we identify these communities and take preventive healthcare to them, as well as curative healthcare. That's one. We also look at people who are marginalized. People like prisoners have been left on their own. When you look at the prison health system, there are a lot of challenges. They've been neglected. You look at children in orphanages. These people do not have adequate resources to be given healthcare. We go to these people. We also go to people who, by virtue of their socio-cultural status, will not seek healthcare. So, for instance, people with negative perceptions about healthcare, they don't want to go to the hospital. They have poor health-seeking behaviors. They don't understand what optimum healthcare is. These people are our targets.
All right. And then looking at the various target of your beneficiaries, what programs do you have in StandOut Care?
At StandOut Care, we do about 4 very important things. The first program we run is the community medical outreach, or the mobile clinic, where we take healthcare professionals, doctors, nurses, lab technicians, dentists, nutritionists. We take these people to the communities with test kits, medications, and all the logistics. And we take the hospital to those communities. So that's the medical outreach or the mobile clinic.
Mm-hmm.
Then we have the health education program, where we target, during the outreaches, we focus a lot on increasing people's awareness about healthcare. So we do health talk during outreaches. Apart from the outreaches, we also go to churches, we go to mosque, we go to schools, we go to business places and organize groups and go deliver health talks to them. So that health education component has been the most important thing we have always been interested in. We employ radio, television, to also deliver health education to these people. Recently, we've created a WhatsApp community. There are about 1,900 members, where on daily basis we share medical knowledge. We educate them on the do's and don'ts of healthcare. The third initiative we are bringing up is a digitization agenda. We are trying to make use of digital media. So we are exploring some interactive voice response service to be able to reach out to larger populations on a larger scale and deliver health education to them. So this essentially is what we do as StandOut Care.
So this is very interesting. You just mentioned about technology, one of the ways you engage Ghanaians. So do you have any ways how to engage more Ghanaians to be more aware of their health and get more, your healthcare services?
Yes, we use the outreaches, we use traditional media, we move into the clinics. I remember during COVID-19, when COVID struck, we took it upon ourselves to engage in health education. We would go into people's homes whilst providing health care for them. We educate them on a lot of tidbits on healthcare. So our outreaches, traditional media, social media, these have essentially been the vehicles we drive healthcare education with.
So when you try to advocate and educate the people in Ghana, is there any Ghanaians that reject, oh no, you don't need your advocacy or your awareness and your training or information from, for example?
Sorry, come again. I didn't get the question well.
So when you're going to homes of the residents in Ghana, is there any rejections? Like for example, they don't need your services, they don't need any information from you because they don't trust you, for example.
No, not really. So the thing about community work is that you need to do what we call community entry. It's a process, and it's manned by principles. You need to go through the right people, you need to go with the right message, and you need to go with cultural sensitivity. Okay. Sometimes some people may need to see evidence of your license, registration, etc. So we make sure that we go well prepared, we carry a very good message. There are a few times when patronage is low, and that's understandable given the kind of environments we find ourselves in and the determinants that will influence people health seeking. But on the whole, I think that Ghanaians have received our solution and what we bring to them. I don't think there's been a time when we faced rejection, but for a few, reduced patronage.
And then, Patrick, what other problems and challenges on the ground that you find in leading StandOut Care programs and how you solve them?
The first challenge is, of course, like every enterprise enterprise, every venture is run on resources. And what we do is very much capital intensive. I mean, imagine the venture of taking a hospital to a community and then to another community. The transportation, the human resource, the medicine, the tests are expensive. And for what we do at StandOut Care, it is intended to be free for the beneficiaries. We are solving access problems. So we don't believe that the beneficiary should pay for it. And hence, our beneficiaries do not pay for our services. When we started, we were leveraging on sponsorships and investments and external funds. And at a point, it was difficult to sustain because the support was no more forthcoming. Now, what we have done is to re-strategize our operation and run it more on partnership basis. So if we are going to a community, we look at what organization or what individual or what philanthropists or which groups have an interest in what we are going to do. We partner with them. We do cost sharing. Sometimes we get people who are willing to support our initiative, and we run it for the communities. We also have had to do medical services for organized groups like corporate businesses. They are able to afford our medical screening services and they pay. Once we make some revenue from them, we are able to plow these revenue into the community-based projects as a way of funding that, and that has helped us sustain it a bit as at now. And then, running a venture like this can have a personal toll on you as a leader. I find that as a challenge sometimes. It can be stressful, having to think through how to sustain the business, how to keep it running, how to manage problems and develop solutions. But I have a well-rounded team. I have a team of people who are very dedicated to the cause, and they make the work easier for me as a team leader all the time. And I'm always grateful to them.
Wow, that's fantastic how you have a strategic partnership with the potential organizations or the companies, and you have a well-rounded team. That's amazing. And then, Patrick, what impacts that StandOut Care has achieved to date until this conversation?
Yes, when you ask me about impact, the first thing I'll say is that we've helped some people from not dying. And for me, that's significant impact. Some people, for certain health risk they had, would have died or would have had complications, predictable and unpredictable. But there are many times when we do outreaches and we detect life-threatening risk. We find people who have illnesses they had no idea of. Illnesses they would have carried along for a long time. And we detect them, we counsel them, and refer them for treatments. And for me, I don't see what's bigger an impact than this. Numerically, since we've been operating, we've touched the lives of about 30,000 Ghanaians directly. People who have had direct access to our healthcare services are around that figure. And you could think of the complications we've prevented, helping people identify their conditions, improving people's know-how. When you come to our community on WhatsApp, people give us good feedback about how we've helped them understand conditions, how we've brought them up to speed with their own health and wellness, how we've empowered them to do more for their own health. And I think these little impacts we've made are for us proudful moments. And when we look at the lives we've changed and the impact we've made, it encourages us to do more.
And last but not least, Patrick, what is your message for young people about health access equality?
When it comes to health access, I believe it is an all inclusive task. If there's any young person who is into health, any young person who has a passion for helping universal health coverage, I think all these young persons should should bring their hands on deck and should make some contribution. You could put five people together and tell them about one medical condition. You could help someone understand why they should take their medications. Let's run minor initiatives, no matter how small it is, in your community, in your school, in your household. I believe that the work of universal health coverage and sustainable development does not entirely lie in the bosom of the government or the political system or the political leaders. I think it has to be decentralized so that people like yourself and I, people who are doing regular jobs, can add very little contributions and give us an ultimate win. I want to encourage young people to be innovative, be entrepreneurial. Don't just think about what you can do for yourself, but think about what you can do for your community or the person who is sitting next to you.
This is such a pleasure, Patrick. Thank you so much for sharing your inspiring story.
Thank you very much.
And thank you, everyone, for joining us. Let's collaborate to make this world into a better place. I'm Glo from JDPNS. Thank you and see you again.